It's something we've all had at some point, that nagging cough. But have you ever stopped to wonder what's really going on in there? A simple cough can actually be the first clue in a pretty fascinating medical detective story. So how do doctors follow that trail?
Right? That's the million-dollar question, isn't it? When is it just a cough, and when is it a signpost pointing to something more serious? Well, in this explainer, we're going to follow that exact diagnostic journey, chasing the clues from that very first cough all the way to a clear diagnosis and, hopefully, a path to recovery.
Okay, so our journey kicks off with the usual suspect, the most common reason for a cough, a chest infection. But even right here, at the very beginning, a doctor has to make a crucial call. Are we dealing with something that'll just go away on its own, or something that needs a closer look?
So let's meet acute bronchitis. This is just an inflammation of your large airways, and it's almost always caused by a virus, especially in the fall and winter. It's why you might be coughing up stuff. And yeah, it's annoying, but the key phrase to remember here is self-limiting. For most of us, it just clears up by itself in about 3 weeks.
Now, this is where the detective work really starts. How do doctors tell acute bronchitis apart from its more serious cousin, pneumonia? Well, with bronchitis, a doctor might hear a wheeze. But with pneumonia, they're listening for very specific, localized sounds like crackles. They call them crepitations, which can literally sound like Velcro being pulled apart. Plus, if you just feel awful all over, achy, totally wiped out, high fever, that's another big clue pointing towards pneumonia.
All right, let's keep going. When the symptoms stick around or seem more severe, the investigation gets wider. Doctors start looking for other clues your body might be giving off, clues that go way beyond just a cough.
And one of the biggest clues is chronic shortness of breath, or what doctors call dyspnea. Now, this isn't just being a bit out of breath after a run, it's that persistent, nagging feeling that you just can't get enough air. And as you're about to see, the list of things that can cause it is, well, it's incredibly broad.
Just take a look at this list. Shortness of breath could point to COPD if you're a smoker. It could be heart failure if it gets worse when you lie down. Maybe it's asthma, or even something as serious as lung cancer. It could even be something outside the lungs entirely, like anemia. Each one has its own little fingerprint, its own set of features that helps the doctor start crossing possibilities off the list.
Now, some clues are definitely more alarming than others. Coughing up blood, hemoptysis, is a huge red flag. This symptom immediately kicks the investigation into high gear. It makes doctors think about really serious possibilities, from lung cancer and TB to a blood clot in the lung, which is called a pulmonary embolism.
And get this, sometimes the clues show up in the most unexpected places. Finger clubbing, where your fingertips get bigger and the nails start to curve around them, can be a direct physical sign of a serious problem in your lungs. It's strongly linked with lung cancer, asbestosis, and other chronic lung diseases. It's just this powerful external clue to a deep internal problem.
So once the doctor has gathered all these clues from your story and a physical exam, it's time to call in the forensics team, This is where modern tech comes in, letting us peer inside the body and turn all those suspicions into cold, hard evidence.
Let's use suspected lung cancer as an example of how this works. It usually starts with a simple chest X-ray. If that shows something that looks a bit off, the next step is a CT scan to get a much more detailed picture. But to be absolutely sure, you might need a bronchoscopy. That's where a tiny camera actually goes into the lungs to grab a tissue sample. And finally, a PET scan can show if the cancer is spread, which is just vital for figuring out the best treatment plan.
But it's not just about pictures. Doctors also need to know how well your lungs are actually working. And that's where pulmonary function tests come in. They help figure out if you have one of two main types of lung disease. With obstructive diseases, like asthma or COPD, it's hard to breathe out. Think of trying to blow air through a really narrow straw. But with restrictive diseases, like pulmonary fibrosis, it's hard to breathe in. It's like your lungs are in a corset that's just too tight to let them expand.
Okay, so this is that moment in the detective story. Where the inspector gathers everyone in the room. All the pieces of the puzzle, the story, the signs, the scans, the tests, they're all laid out on the table to finally reveal the answer.
And doctors have some really brilliant tools to help them make sense of it all. Take the CRB-65 score for pneumonia. It's a super simple but incredibly powerful checklist. You get 1 point for each of these: confusion, a high respiratory rate, low blood pressure, and being 65 or older. And this isn't just about getting a diagnosis. It's about making a critical decision. Can we treat this person at home, or do they need to be in the hospital right now? And this chart just shows you exactly why that score is so important. Look, a score of 0 means your risk of dying is super low, less than 1%. But check out what happens as the score goes up.
If you hit a 3 or a 4, that risk jumps to over 10%. It's amazing. This simple score gives an objective measure of risk that helps guide these massive life or death decisions.
Putting the pieces together also means looking at a person's entire life story. This quote is a perfect example. We hear asbestos and we immediately think of mesothelioma, right? It's a rare cancer of the lung lining. But here's the twist. Asbestos exposure is actually way more likely to cause regular lung cancer, and that risk just goes through the roof if you also smoke. A person's history is everything.
And that history can have absolutely devastating consequences. This number is just a stark reminder of how severe these occupational lung diseases can be. A median survival of just 8 to 14 months for mesothelioma, it just hammers home why understanding risks, catching things early, and prevention are so important.
But, a diagnosis isn't the end of the story. For the patient, it's really the start of a whole new chapter: treatment, management, and that journey back to health. So let's take a look at what that path forward can look like.
Recovery really takes time, and I think it's so important for people to have realistic expectations. For something pretty common like pneumonia, you can see it's a gradual process. Yeah, your fever should be gone in a week, but it can take up to 6 months before you truly feel like your old self again. Just knowing that can be incredibly reassuring when you're in the middle of a long recovery.
And for so many chronic conditions like asthma and COPD, managing them well really comes down to the details. Getting your inhaler technique right is absolutely critical. That's how the medicine actually gets to your lungs where it needs to do its job. Following these 5 simple steps can make a world of difference in controlling your symptoms and just breathing easier every single day.
So, from a simple cough all the way to a complex diagnosis, the story of respiratory disease is really a journey of just listening to the clues. Our lungs work nonstop, taking more than 20,000 breaths every single day. The real question is, are we paying attention to what they're trying to tell us? Because listening closely, that could make all the difference.